we know is that environmental exposures touch every single organ system in the body and are linked to nearly every single health issue that we're seeing in our population. This is a really, really short list of some of the health effects that are as a result, or at least partially as a result, of environmental exposures. Now, given this, you would think that our medical and healthcare providers would be well versed in these issues. They are not. There is an enormous education gap. Now, in the nutrition space, we are often outraged to learn that medical doctors only receive around 19 to 21 hours in nutrition education during their entire academic career. When it comes to education on environmental toxicant exposures, the figures are even worse. A 2016 article on the American Association of Medical Colleges website sums up this problem very succinctly. They write, "An Institute of Medicine report 20 years ago framed the need for an environmental health perspective in medical practice and suggested 6 related learning objectives for medical students. In a study of pediatricians published in 2006, however, just 1 in 5 had received training in environmental history taking. An earlier study reported that in medical schools requiring content related to environmental medicine, students received just 7 hours of such training. Nearly 1/4 of schools surveyed did not require any environmental content. And the AAMC's 2013 survey of medical school graduates found that more than 1/3 of respondents said they received inadequate instruction in environmental health. An article published in 2011 in the American Journal of Preventive Medicine states that although environmental factors contribute to more than 25% of all global disease, and toxic agents ranked 5th in underlying causes of death, U.S. deaths in 2000, environmental medicine education is largely omitted in the continuum of U.S. medical education. Now, I want to be clear here, this is not the fault of the medical professional, but rather a product of medical school curriculum being slow to update and to modernize. So we know, for example, that there is a 17-year research to practice gap that exists in medicine. Changing medical school curriculum likely takes even longer. Now, other types of health professionals, nutritionists, health coaches, naturopaths, occupational therapists, PTs, nurses, etc., often have zero education and they're left on their own to figure this out if they learn about it at all.